Across the University of Pittsburgh landscape, in laboratories large and small, scientists are working round the clock chasing the coronavirus.
So I don't sleep super well. I'm up often. People get emails from me at 3 a.m. when I can't sleep.
Jeremy Berg is a biochemist and is among those overseeing the research at the university. He compares the vigor of the coronavirus research to the days in the 1980s when scientists were searching for an AIDS cure.
How would you compare the speed with which this is progressing with how it progressed back then?
Yeah, so I was a young department chair at Johns Hopkins Medical School when the AIDS crisis broke, and it was pretty terrifying. I mean, there were serious discussions. I remember sitting around the table saying, our hospitals are going to be full of AIDS patients. Where are we going to put everybody else?
Sound familiar? Decades later, there are treatments for AIDS, but still no vaccine. Dr. Berg believes today's researchers will find a corona vaccine by sharing what they are learning.
There are groups that are compiling sequences of the virus from around the world, and comparing those sequences can tell you a lot, both about the virus, but also how it moves between different populations.
Grants are funding more than a dozen coronavirus research projects at the university. 2 show early promise, one that delivers the medicine through a small skin patch.
Think about them as almost like a Band-Aid. And so the microneedle array is simply applied to the skin topically, pressed into place very shortly, and then taken off and thrown away.
A different approach would use the existing measles vaccine to deliver the coronavirus antigens. The first step is testing on animals.
And then, and only then, can you move that forward into the next stage, the phase 1 clinical trials, which are small numbers of very healthy people who will receive the candidate vaccine.
The first human trials may not begin until the fall, meaning a vaccine for everyone might take a year or longer. But Dr. Berg is optimistic that a vaccine is in our future.
At the one hand, it's a very sad, awful situation. On the other hand, it is exhilarating to see all the researchers sort of rolling up their sleeves and getting energized to try to tackle this problem.